Hi, my name is Vicky Castillo, and I'm a nurse and the founder of Fastest Healthcare Training, a CNA test prep. In a previous video, I talked about the type of work a certified nursing assistant or certified nurse aide does and where they work. Today, I'm going to discuss how to become a certified nursing assistant, also called CNA. First, you must know that becoming a CNA is specific to each state. In other words, each state determines training requirements. So the training requirement to become a CNA is different in California versus Florida versus Michigan and each of the 50 states. So training varies from state to state. Before we proceed, let's talk about terminology. A certified nursing assistant or certified nurse aide is an individual who has passed the training requirements set forth by their state and passed the certification exam. Thus the word certified. Conversely, a nursing assistant or nurse aide is an individual who has completed the training requirements or taken the course, but has not yet passed the certification exam. Please note, it is illegal for a person to use the title certified nursing assistant or certified nurse aide or CNA if the person has not passed the certification exam. So let's start with step one on how to become a CNA, finding a nursing assistant school. You can find many schools in your local area by doing an internet search. Another way to find nursing assistant schools is by going to the website of your state CNA regulating body and looking for approved schools in your state. In some states, CNAs are regulated by the State Board of Nursing and for some, the state's Department of Health Services. Because some of the state websites can be kind of complex to maneuver, it's often difficult to find the list of approved nursing assistant schools in your state. But with a little perseverance, you will have success. But again, use the key terms approved nursing assistant schools or approved nurse aide schools in the state website. Hopefully you'll have some success. I believe you will. So before moving on to step two, let's talk about where nursing assistant courses are offered. They're offered in high schools, usually at the junior and senior level, at community colleges, typically over a semester, at nursing homes, also known as skilled nursing facilities or extended care facilities, different terminology, but they're nursing homes, and at private schools, which of course are privately owned. Regardless of where you take a nursing assistant course, you must verify that the school is approved by your state's regulatory agency. If it is not, the school is conducting business illegally and you should not attend it. If you have any doubts whether a school is legitimate or not, again, contact your state regulating agency. Step two. Once you find a school, go to the website and check where they are located because some schools have multiple locations. Take a tour of the school, go to the campus. You'll get a feel for their customer service, the courses that they offer, their instructors, the campus, the resources that they provide on campus. Do they provide computers, their textbooks? Do they have studies areas? And it will help answer many of your questions. Also, you'll be able to check out their available class dates, times, tuition, non-tuition costs, and course requirements. So, are you looking for a daytime class, an evening class, a weekend class? Is the course a hybrid course or 100% on ground? Regardless of whether the course is hybrid or 100% on ground, you must still attend on ground to be checked off on skills competency and to attend clinicals, which usually occur at a skilled nursing facility or a nursing home. The clinicals do. Okay, the competency checkoffs usually happens at the school, but the clinicals occur at a skilled nursing facility. All these factors vary from school to school, so be sure to compare schools so you can make an informed decision. Step 3, let's talk about the cost of taking a nursing assistant course. If you're taking a course at a nursing home, there's typically no cost. However, the nursing home usually requires a signed contract, a work commitment for about a year or two upon becoming a CNA. You need to decide the pros and cons of this option. At a community college, you'll need to look at their per credit costs and any other costs associated with the course. Important, federal student loan funding is not available for nursing assistant courses. Also, community colleges generally do give credit for taking a CNA class, so keep that in mind as well, okay? Whereas the other options do not. Private school courses. Costs vary widely. However, most have in-house financing options which are affordable and have a low interest rate. At a high school, of course, typically there are no costs to the student, but sometimes there might be some incidental charges or costs, but usually very minimal. Regardless of where you take a nursing assistant course, whether at a nursing home, community college, high school, or private school, the cost is typically about $2,500. Some are less, some are a little bit more, but I'm just giving a national average approximately, about $2,500. Step 4, carefully compare the cost of the courses. If one school charges $500 and the other school charges $1,000, it's a huge mistake to think you're getting a bargain at the school that charges $500. It's critical, I say critical, that you take a look at what you get for the $500. What's included? So, okay, you pay $500 for the course, but maybe you still have to buy your own textbooks. Maybe you still have to buy your own workbooks, your scrubs, your gait belt, your CPR, your TB skin test, your fingerprints, etc. Then you may not think that the $500 is such a good value, right? But maybe when you look at the $1,000 course, if it includes everything, perhaps that's going to be a bit better value for you. So it's very important that you compare apples to apples. Do your research, do your homework, and look at what's included in the tuition and what's not included in the tuition, which is your out-of-pocket costs. Take a look at their financing options, their costs, other incidental costs that you will be responsible for. Also keep in mind that there is a cost to taking the certification test, which is about $130, give or take, okay, about $130 to take the certification test. Step 5, know the school's certification pass rate. That's a state pass rate. This information is sometimes made public by the state regulating body, but sometimes not. Nevertheless, you should ask the school what their pass rate is and use this information to make your decision. The state regulating body for nursing assistant training requires every school maintain a certain pass rate. Sadly, some schools are just barely above that requirement and some are very much above this requirement. This is important information because you want to attend a school that has a strong enough curriculum that prepares you well and gives you the most chance to pass a certification test, as well as prepares you well for the workplace. For example, if ABC school's pass rate is 70% and XYZ school's pass rate is 95%, you need to highly consider XYZ school's attending XYZ school because they've proven they have a strong program and that can help you pass the certification test the first time. Also check to see if the school has any deficiencies or infractions against them from the state regulating body. This is public information and you should know this when making a decision. Finally, when you do choose a nursing assistant course, we at Fastest Healthcare Training are here to help you ace your course and pass the certification test the first time. So check us out at www.fastesthealthcare.com, and I hope this information has been helpful in helping you choose your nursing assistant school. Best wishes to you. Thank you.